Hi everyone, today we are going to discuss about chronic kidney disease. First one, introduction of chronic kidney disease. Chronic kidney disease is a progressive condition characterized by a gradual loss of kidney function over a period of at least 3 months. The kidney play a vital role in maintaining body internal environment by filtering the waste products, excess fluids and toxins from the blood, regulating the electrolyte balance, controlling the blood pressure and producing hormones involved in red blood cells formation and bone health. Next, definition of CKD. Chronic kidney disease is a long-term condition in which the kidney are gradually lost their ability to filter waste products and excess fluids from the blood. The CKD persists of 3 months or more than can eventually progress to kidney failure if untreated. Next, the leading causes of CKD. First one, the diabetes are the major cause of CKD and hypertension, obstructed urine flow, kidney disease, kidney artery stenosis, then certain toxins including fuel solvents such as carbon tetrachloride and lead etc. Then fatal development problems. These are the causes leading of CKD in dialysis patients. The main incidence of CKD in India, according to nephrology, the dialysis transplantation there are 7.85 million CRF patient in India. Etiologically, diabetics 41% of patients causes. Then the hypertension 22% are included. Chronic glomerular nephritis is 60% in certain patients, and the chronic intestinal diseases is 5.4%. The ischemic nephropathy 5.4%, and then obstructive uropathy is 2.7%, and miscellaneous 2.7%, and unknown causes is 5.4% and constitute the spectrum. Then the CKD is estimated to more than in the women than in men in approximately 60% versus in 30%. Next, we are discussing about the risk factors of CKD. First one is diabetic mellitus, then hypertension. Next one is the cardiovascular disease. The another factor is obesity, age, race, and the acute kidney injury or AKI or disease, malignancy, and family history of chronic kidney disease condition. Then the last one is kidney stone. Next, we are discussing about the pharmacological management of chronic kidney disease patients. This first one is antihypertensive and cardiovascular agents. The anti-seizures agents and erythropoietin reports, the antidiuretics and antacids, and the hyperphosphatemia and hypocalcemia are treated with the aluminum-based antacids that bind dietary phosphorus in GI tract, gastrointestinal tract. The nutritional therapy is approximately 35 calorie of kgs less than 60 years, 30 to 35 calorie or kgd, or that increases 60 years of age patient to increase the energy and content of meals. The main reported cases add extra oil to rice noodles, and the unhealthy factor are the important one, and the added extra salt or the cooked vegetables and non-protein calorie supplements can be added. The other therapy of CKD, the dialysis is used to remove fluid and remove waste products from the body. When the kidney cannot do something and it may also be used to treat the patients with edema that does not responses and or treatment hepatic coma. The other conditions are hepatic coma, hyperkalemia, hypercalcemia, hypertension, uremic. These are the two types. First one, dialysis. The dialysis depends on two types: hemodialysis and peritoneal dialysis. Hemodialysis, then another hemodialysis is a machine process. Peritoneal dialysis is in peritoneum region, and the last one is renal transplantation. Renal transplantation is the treatment of choice for patients with irreversible kidney failures. Then, however, the use of transplantation is limited by organ availability. These are the therapies and nutrition values of CKD. Then the intradialytic complication. First one, the most common complication is hypertension. Incidence of 50% to 30% of common in people. Then muscle cramps, dialysis disequilibrium syndrome. Then dialysis reactions is first use syndrome, arrhythmia, cardiac arrest, intradialytic hemolytic, and then hypoglycemia, hemorrhage, toxic water system treatment, contaminants, hemolysis, osteomyelitis, and the anemia, encephalopathy, fluoride, bone disease. The complications included of CKD, chronic kidney disease, fluid retention, hyperkalemia, cardiovascular diseases, and another condition, then weak bone and increased risk of bone fracture, anemia, then the decreased sex drive, erectile dysfunctions, and reduce the fertility. Damage to your central nervous system, decrease the immune response. The pregnancy complication that carry risk of mothers and developing fetus. The fluid retentions means which included lead to swelling in the arms and the legs, high blood pressures, or fluid in the lungs. Condition is known as pulmonary edema. A sudden rises in potassium level in your blood, hyperkalemia, which could impair the heart ability to function and may be life-threatening. Then the heart and blood vessels, cardiovascular disease, weak bones, and can increase the risk of bone fracture. The another condition is decrease the immune response, and which make you more vulnerable to infection. Pericarditis. Pericarditis means inflammation of ductal membrane with the envelopes in heart pericardium region. Next, diagnostic evaluation. First one is history collection of the patient, then the physical examination. These are the main evaluations. Then the urine output measurement, measuring how much urinated in 24 hours. Then urine tests, blood tests, imaging tests. Then removing the samples of kidney tissue. First urine output measurement, then the urine test, analysis, samples of the urine reveal abnormality that suggested the kidney failure. The blood test, a sample of blood may reveal rapidly rising of levels of urea and creatine, two substances used to measure the kidney function. Then imaging tests such as ultrasound or computerized tomography may be used to help the doctor see your kidney. Then removing the samples of kidney tissues for testing. In some situations, a kidney biopsy to remove the small samples of kidney for lab testing. Your doctor is inserted a needle through the skin and into the kidney to remove the sample. These are known as biopsy or removing samples of kidney tissue testing. Next, management of CKD. First, high blood pressure medication. People with the kidney disease may experience worsening high blood pressure. The doctor may recommend medication to lower the blood pressure. Commonly, angiotensin converting enzymes inhibitors or angiotensin receptor blockers to preserve the kidney functions. And high blood pressure medications is initially decrease the kidney function and change the electrolytes level. Then you may need to frequent blood tests to monitor your condition. Medication to lower cholesterol level. The people with chronic kidney disease often the experiences level of bad cholesterol and which can increases the risk of heart disease. The medication to treat anemia. In certain situations, the doctor may recommend supplements of erythropoietin, sometimes with the added iron. The erythropoietin supplements aid to the production of more red blood cells, which may relieve fatigue and weakness associated with the anemic patient. The main causes, first one is diabetes. Diabetes included type 1 or type 2 diabetes, high blood pressure, glomerulonephritis, and inflammation of kidney filtering the units like glomeruli. The industrial nephritis is the inflammation of the kidney tubules and surrounding the structure. Then the another condition is polycystic kidney disease and prolonged obstructions of urinary tract from the conditions such as enlarged prostate, then kidney stones and some cancers are the cause, and the vesicorenal reflexes and conditions is that causes urine to wake up the kidneys, and recurrent kidney infections also called pyelonephritis. The treatment of end-stage kidney disease or CKD. First one is dialysis. Next one is kidney transplant. First, dialysis is a artificial remove waste products and extra fluids from the blood when the kidney can no longer to do this. In hemodialysis, a machine filters waste and excess fluids from the blood. In peritoneal dialysis, a thin tube catheter inserted to the abdominal and fill the abdominal cavity with a dialysis solution that absorb the waste and excess fluid. After a period of time, the dialysis solution drains from the body, then carry the waste with it. These are the dialysis method. Dialysis method is two type: hemodialysis and peritoneal dialysis. The next one is kidney transplant. Kidney transplant involves a surgical placing a kidney from the donor into the body. The transplanted kidney can come from the deceased or living donor. Deceased donor means brain death or cadaveric donor. Living donor is the relatives or donors, and the patients need to take the medications for the rest of your life to keep the body for rejecting the new organ. Thank you.